For whites, black male students are almost twice as likely as white males to drop out of school, and in some big American cities, the dropout rate is around 50%. In some South LA neighborhoods, this seems more common than this.
Black males now make up only 5% of the college enrollment nationally, but 36% of the prison population.
Researchers say this isn't just a crisis affecting African Americans. This crisis affects all Americans. Dropouts cost taxpayers more than $8 billion annually in public assistance programs like food stamps. It costs more than $25,000 to incarcerate an inmate for a year, but only about $14,000 a year for a student to attend community college. Researchers call these dismal numbers a call to action for scholars across the country to study this problem and come up with real solutions.
The problem can't be quarantined. It's not as if the problems of black males will stay in black communities. These things metastasize across the body politic. They spread out like a cancerous cell, and they begin to impact and affect others.
How many of you are going to go to college? Daniel and others in the self-proclaimed nerd herd at Cam High in South LA plan to beat the odds.
I just push myself to make sure that I get there and that the generation behind me can look up to people like me.
Hoping to reverse this pattern of failure. Bill Whitaker, CBS News, Los Angeles.
So that kind of like highlights some of the barriers and obstacles that we face in finding qualified underrepresented minority male applicants and in diversifying our health professions and health care system. But before I go into more about that, I just wanted to go over some of the statistics as far as physicians currently in the demographics. So the AAMC defines underrepresented minorities as racial and ethnic groups that are underrepresented in the medical professions relative to the numbers in the general population. So in the 2009 U.S. Census, Latinos, African Americans, Native Americans make up about 30% of the U.S. population, but only 6.4% of the physicians in the U.S. And these numbers have improved slightly, but have remained stagnant over the last 3 decades. So when you look at the ratio between men and women who actually apply to medical school, and this is data from the AAMC, across racial categories, they're pretty much the same except for black males. And you can see there, only 30% of black males are actually applying for medical school, and this has been a significant decline. And if you add up the Native Americans, black males, and Hispanics, they only make up 5.7% of the applicant pool. And this is pretty much looking at the same thing over the last 3 decades, and but only comparing whites to blacks. And so back in 1980, 80% of whites were male and about 20% were female. And 2008, those numbers have kind of been close to 50-50. Whereas if you look at African Americans, 60% were male back in 1980 and 40% were female. And close to the late 80s, there was a reversal, and now 70% are African American female and 30% are male. So how has UNC fared? This is pretty much self-collected data, and from students who self-identify among these 3 groups. And we have aggressive recruitment, but we still struggle in recruiting qualified applicants. And in the student body currently, there's about 3.2% that are African American. And I'm sure you're wondering who that one-half Latino guy is, and that's actually me. And we have one Native American guy who's a second year currently. So why am I belaboring the numbers? There have been numerous studies that have shown that when you look at racial concordance as well as language concordance, and between the patient and the practitioner, this can actually improve health outcomes. And the Health and Human Services Department in 2006 did a systematic review that was published that looked at numerous studies across the board and looked at these factors of how diversity can actually improve health outcomes. The first one, number one, underrepresented minorities are actually more likely to serve in underserved areas, treat patients who are Medicaid insured or uninsured, and also care for patients, regardless of their racial status, who have a poor health status. If they're among patients, patients who have a concordant racial or language provider have a higher sense of trust, are more likely to come back for follow-up appointments, more likely to seek care from providers that share that group with them. And there is some data that suggests that increasing underrepresented minorities in healthcare fields actually increases advocacy and programs for those disadvantaged groups. And so those all kind of culminate to increasing access and utilization amongst disadvantaged groups, improve patient satisfaction with their care. Latinos in particular feel like if they have someone whose language concordant, they have a better understanding of their medical issues and their problems, and are more likely to adhere to recommendations by their physician. And lastly, we hope to show eventually that having increased diversity will actually decrease the disparities that are present today in the healthcare system.
So based on some of the statistics that we've seen, Mike and I started having a discussion about what we can do to change some of this statistics. We started in the late months of 2008. We wanted to come up with a program that will help support minority males from the UNC undergraduate curriculum. And Mike and I shared our experiences as undergraduates here. Even though we graduated at different times, we realized that there were some shared experiences there that were pretty much the same. There was a lack of adequate counseling and mentoring that we perceived from the our undergraduate counselors. And we compared ourselves to other minority males who, when we came in as freshmen, were pre-med. But by senior year, we found out that a lot of us had been discouraged or for some reason or another lost that dream to go to medical school. And Mike was actually one of the only one from his class that matriculated to medical school, and I was the only one I knew of that matriculated to UNC Medical School out of a class of about 4,000 students in total. So one common ground that we did share was that Dean Larry Keith, who is shown here, was very instrumental in both of us getting into UNC Medical School, and I'm sure a lot of the underrepresented students here will say the same as well. And we were actually fortunate to discuss this program with him, and he supported us. It was actually at our first inaugural meeting in the spring of 2009. And even though it was at the late stages of his illness at the time, so we wanted to recognize him today. Today being a year and a day to the day that he passed away. So main mission is to support minority men pursuing careers in health professions. Our specific goals are retaining students who come in as pre-med up until their senior year. We wanted to increase our GPA of students who had subpar GPAs, and also maintain those who had stable GPAs. We also created some community service opportunities for the undergrads and foster interest by inviting faculty speakers to meetings. And ultimate goal was increasing the statistics of minority males matriculating to medical school. So what we do, basically we have a 4-hour weekly study hall for the undergraduate minority males in Bondurant, and we do this because we wanted to focus on academics for the undergrads, and we believe the college atmosphere sometimes encourages fun and extracurricular activities, so we wanted to make sure they have that focus. And at the same time, we created programs where we do study skills, we talk about summer opportunities, time management, we help with the medical school application process, and even conduct mock interviews for people who are getting ready to apply. We provide one-on-one mentorship, which we believe is essential to being successful, and also created exposure to the medical faculty of all the diverse backgrounds and fields. We pretty much wanted to bridge that gap between the undergraduate and even medical students and medical faculty members. We also have faculty members who come to talk, like I said earlier, and we encourage an atmosphere of support and